Hello and welcome back to the session. இன்னைக்கு நம்ம கவர் பண்ண போகிறது is rather a remarkable infection called as Melioidosis, and it's caused by இன்னொரு peculiar organism, Burkholderia pseudomallei. இது எப்படி ஞாபகம் வச்சுக்கலாம்னா, the women who wear burqa also wear caul, அந்த மாதிரி ஞாபகம் வச்சுக்கலாம். So Burkholderia pseudomallei. So it's a saprophytic gram-negative motile bacillus. It's endemic to Southeast Asia and Northern Australia. It's clinically notorious for its ability to mimic other diseases like TB and pneumonia, and its capacity for extreme latency with symptoms sometimes appearing decades after exposure. So structure and morphology la pathona, these are small gram-negative rods with a characteristic safety pin appearance. So culture, it grows on standard media, but it's best isolated on ash downs agar, where it forms wrinkled purple colonies with musty odor. It uses polar flagella to move through the soil and water. So in the bacterium, it's basically a sleeping saboteur. It does not look much, just a small safety pin shaped tool, but it is like designed to blend into the environment rather than a soil and wait for the perfect moment to infiltrate. So virulence factors pathona, we have like almost 4 of them. Type 3 secretion system, so T3SS solitaire. A molecular syringe that injects effector proteins directly into the host cells to subvert the immune response is called as T3SS. And then we have a capsule. It's a polysaccharide coating that prevents phagocytosis and complement mediated killing. அடுத்து we have this intracellular survival. So it's basically capable of escaping the phagosome to live and replicate within the host cell cytoplasm. And BIM-A protein solito onnu irukku. So this basically hijacks host actin to move between cells without entering the extracellular space. And this is called as actin-based motility. Pathogenesis and host immune response. First nadakkuradhu inoculation. So entry occurs via skin aberrations common in rice farmers, inhalation during monsoons, or ingestion. Once inside, the saboteur enters the macrophages using its T3SS syringe. It prevents the cell from surrounding alarm. So it uses host actin to push itself into neighboring cells, forming multinucleated giant cells. It can remain dormant in host files for years, protected from immune system. One way to reactivate during periods of immunosuppression, other during in case of diabetes or something else. The saboteur doesn't just attack the building, he moves through the vents, actin-based mobility valiya. He travels from room to room without stepping into the hallways where security cameras could see him. He can stay hidden in the basement for 20 years before suddenly blowing up the fuse. Microscopy, we could see bipolar staining on gram or right Giemsa stain. Serology, we could see IHA, that the indirect hemagglutination, and it's common in endemic areas but has a low specificity. Gold standard, we take culture from blood, sputum, or abscess aspirate. Lab staff must be notified if Burkholderia is suspected, as it's a significant laboratory acquired infection risk. Prevention, we advise people to use protective gear like boots or gloves for workers in endemic soil or water, and strict glycemic control, as diabetes mellitus is the single most important risk factor for severe melioidosis. Treatment, we have 2 phases. Intensive phase, it's for initial 2 to 4 weeks. High dose IV ceftazidime or meropenem to stop the acute spread. And eradication phase, basically it occurs for 3 to 6 months based on the severity. Oral trimethoprim sulfamethoxazole to ensure no dormant saboteurs remain in the tissue. So you cannot just kick off the saboteur at once. So we flood the building with gas at the intensive phase to stop the immediate threat, and then keep a security guard at every door for 6 whole months to make sure that he doesn't crawl back out of the vents. So when you see a TB like pneumonia in a patient with diabetes who recently traveled to somewhere like Thailand or Australia, there it is, think of melioidosis. So for the remaining details, look, skim through apurva. It's really important to skim through apurva.